So look at this scenario. You're looking at your community. You realize that you have quite a few people who can't afford health insurance. They're very low income. Their only medical options are the emergency room at the hospital or nothing at all. What do you do? Well, in 2009, there was a nurse in Peachtree City, Georgia, who was sitting in her Sunday school class at the First Baptist Church, and she decided to do something about it. And she started the Healing Bridge Clinic in Peachtree City, which services multiple counties now and provides a multitude of medical services. You can do this as well in your community. And our interview today, we're going to show you how to do it. We're going to give you a description of what they're doing at the Healing Bridge Clinic, and I think you're going to enjoy it. It's more a lesson on having the will to take care of a problem, not allowing the government to botch it up, and we do it ourselves with volunteers and help our fellow man. I hope you enjoy the interview. Hello and welcome. We've got Mike Conaway and Sydney Weaver joining us today. Great to have you guys. Thanks for joining us at Editorial Interchange.
Thanks for the invitation.
Yes, thank you.
Hey, tell us what you do with the Healing Bridge Clinic, and then we're going to ask you if you want to give some local shout outs to locally owned businesses in your area. Mike, go ahead. We'll start with you.
Sure. So the Healing Bridge Clinic provides health care at no charge to the uninsured residents of Fayette and surrounding counties who meet our eligibility requirements. And those requirements are that they live at or below 200% of the federal poverty level.
And Sydney, what do you do with the clinic?
So I am a nurse practitioner who volunteers at the clinic, and I have been doing so about a year and a half now.
Well, we love to highlight local businesses in our area, all over metropolitan Atlanta. And can you give a shout out to a locally owned business in your area? Sydney, we'll start with you.
Yeah, so Health Springs Direct is a direct primary care business in Peachtree City, and I've come to know several of the providers there and just absolutely love it.
How about you, Mike?
Yeah, I'd like to highlight Mesia Construction here in Peachtree City. They are a large construction company that also does smaller jobs, and we were fortunate enough to pick them to do our recent remodel, and they were just amazing to work with. And we just want to give those guys over there a shout out for all they do for the community.
Awesome. And later on in the interview, we'll talk about a little bit of that construction and what you're doing with the clinic.
Great.
Hey, to start off with, Mike, give us like a 50,000 foot overview of what the clinic is and where it's located.
Yeah. So we're located at 215 Willow Bend Road, right across the street from First Baptist Church here in Peachtree City. And it was started in 2008, a dream from a retired nurse. Told her Sunday school class one Sunday morning that she thought they ought to start a free clinic. And the clinic was birthed. And in 2009, they saw their first patient in September of 2009. And we've been serving the Fayette and surrounding communities ever since.
Doesn't every great idea just start with somebody who says, I've got this idea, and by golly, I'm just going to try it.
It
You know,
does.
every good thing starts that way.
Right.
How many employees and volunteers do you have, Mike, working with the clinic?
So we have 5 employees. We have 2 full-time and 3 part-time employees. But the key to our success is our volunteer pool. We have over 80 active volunteers. 27 of those volunteers are providers, doctors, nurse practitioners, physician assistants in the Fayette and Coweta County area that come and volunteer. They volunteer everything from once every other month to one day or night a month to multiple days a month. And some, like Sydney, are there every week, sometimes 2 days a week volunteering. We could not do what we do and serve the people we serve without these dedicated volunteers.
And the clinic, I believe, did it start in 2009? Was that the correct date?
Correct.
And it has evolved since then, right? So has it been kind of an expansion of services and things of that nature over time?
Yeah. So when it started out, it was literally just a Sunday school class project. And it was the members of Miss Ruth's class that were her support team, her volunteer team, her board of directors. And they were open one Thursday night a month, would see a handful of patients, 5 to 7 patients a night. And it stayed that way for multiple years. And along about 2014, 2015, they kind of expanded to 2 nights a month, 2 Thursday nights a month. And then along about 2017, 18, they opened up 1 day a month. And then since then in 2018, I came on in January of 2018 and really started focusing on expanding the clinic. And we started adding services. We started adding to the volunteer pool. And now we're open multiple days a month. We don't have a set schedule for the most part because we work on volunteer provider schedules. But typically we're open about 12 days a month. And an average month for us, we'll see 120 to 150 patients in those 12 days.
Wow, that's impressive. And you started this. Well, the thing started, and it started evolving over time. It started as I think Miss Ruth was a nurse practitioner. Was that correct? The woman
Just a
who
registered nurse. Yeah, she was a
registered nurse.
registered
Okay,
nurse. Yeah.
and so you just had this idea. It started. Then you have to decide at some point, when you're doing this clinic, who can we see and who's the clinic directed to, and give us who the target audience is for the Healing Bridge Clinic.
Yeah. So from day one, the target audience has always been the underserved community. So they've always focused on people who live at or below the 200% federal poverty level. Um, this area was different back in 2008 and 9 than it is today. Um, and, Peachtree City wasn't necessarily a pool of potential patients back in 08, 09, to where today there's more and more patients that are just local, like drive their golf carts to get to us, as times have changed over the years. The initial target was Fayette, Coweta, and South Fulton counties. And when I started at the clinic, I asked my board for a definition of South Fulton and got we had 10 board members at the time, and I got 10 different answers. So I'm like, well, that doesn't make sense. We don't even know who that audience is. So why don't we say Fayette and surrounding counties? And the idea behind that, Steve, was if we're Fayette, Coweta, and South Fulton only, it's really hard for me to build a relationship with a potential donor or partner in, let's say, Meriwether County or Henry County, if we're not serving that area. So we say Fayette and surrounding, and people say, well, define surrounding. And I'm like, if you can get here and you meet the eligibility requirements, then you're a patient. So we literally have patients who went through a season as a patient of ours, have moved on to maybe jobs or moved to different areas and still qualify for our services. So they'll come back. So like we have patients that drive over an hour to get to an appointment. So that's just a testament, I think, to the care they provide, the relationships that we build with patients, the relationships that our providers build with our patients, that the patients, we had one today that came in for the last time because she finally qualifies for Medicaid, and she's finally been accepted to Medicaid. And it was a celebration at one point and a lot of hugs and tears at another point because she doesn't want to leave because she knows the care she's been getting is far superior to what she's going to be getting because of just unfortunately the way the medical system is today.
Well, one thing I would love to achieve with this interview is, giving other people in Metro Atlanta and the other parts of Georgia an idea that we could possibly do something like this. Give people an opportunity. We're so used to just throwing everything to the hospital ER, or let the federal government try to do it or the state government try to do it. And traditionally, a lot of the hospitals that we had, I remember I was born in Georgia Baptist Hospital. It was run by the Baptist Church. Emory, had a lot of Methodist Church money, and a lot of the money they were doing, services they were providing. And the church was an integral part of it. And I know your clinic is in a building that started off, I think, as the youth building, right? For the local First Baptist Church. And it became several different things, iterations the building was used for. So you didn't have a fancy medical facility with state-of-the-art, exam rooms and things of that nature. You started off with what you had, right?
Yeah. So we started out in a building. The building that we're in was actually built in 1971 as a kinder care. And I wasn't in Peachtree City at the time, but it had to be one of the few kinder cares at the time. I mean, when you look at the age of Peachtree City. Um, so it was a kinder care building. The church bought it somewhere late 90s, early 2000s, somewhere around the millennia. They bought it along with the apartments that used to sit there beside them as well. Um, and then once the church bought the building, it became everything from their mom's morning out to their children's ministry to their youth ministry because they were building all across the street. Um, and then they moved their Hispanic ministry in it a little before the Healing Bridge opened. So for the first 14 years of our existence, we shared that space with primarily the Hispanic ministry of First Baptist Church, but also other ministries over there. The building was theirs and it was a multi-use building. So for 14 years, we literally set up every clinic day and tore down every clinic day. So we're adding a couple hours to the beginning clinic and end of clinic, and volunteer nurses are coming and setting up chairs and folding tables and getting everything out of the closets and setting up computers and doing all of that because of the shared space. We just weren't able to leave stuff out. So, you know, most clinics in the state, there's about 100, a little over 100 clinics in the state of Georgia. I would say 90+% of them are started in a church or actually exist inside of a church building, or in our case, we lease space from a church. They're all a little bit different. Some of them are not their own 501c3s. They function under the church that they sprouted out of. The Healing Bridge Clinic, when it was developed and the original bylaws were written, um, and the 501c3 letter was obtained, it was obtained as a standalone 501c3. So while we don't have technically any affiliation with First Baptist Church, we have a history with First Baptist Church, and we're going to stay and keep that commitment to them because of what they've done for us in the early years. We're going to keep that relationship there. And plus, we have a long-term lease in the building that we're in now that we're sole proprietor of the building, possessor of the building. We're going to keep that relationship with them, and we plan to stay there. You know, till something happens to the building, we're going to be there.
Well, I think the important lesson in this is, you can start off with, just the basics.
Yep.
So many people think, hey, I want to do this I want to build this clinic, or I want to do this business or provide this service, and I've got to have the state of the art everything, and I've got to build my own building and all this kind of stuff like this. And if you really look and you find the right partner, and the church, it was the First Baptist Church in this case, um, you can really do a lot with little and just grow the effort as it goes on, which is what you've done.
So technically, the clinic started. Miss Ruth was the congregational nurse at First Baptist Church back then. So literally, the clinic birthed out of her setting up a table on Sunday mornings and checking blood pressures of people. I mean, that's literally how the clinic started.
Yeah.
Just so people would know what their blood pressure was, and she was giving them, kind of counsel on what they need to do to lower their blood pressures and so forth. I mean, that's kind of if you want to talk grassroots, that's the roots of our clinic today, and how it started. So yes, you don't need. I mean, technology's great, gadgets are great, but you don't need that. You can go back to old school, and get and still make a difference and an impact in someone's life without having to have all that stuff.
Absolutely. Well, Sydney, tell us about what kind of services the clinic offers now.
So we provide everything from, I would say basic primary care services, and we've really expanded the specialty services that are available. So Mike, catch me if I neglect to mention
Sure.
any of them, but we have cardiology, gynecology, orthopedics, neurology, psychiatry. Those are just some of the services. We have this fabulous diabetes educator that, most, commercially insured practices don't even have access to, quite honestly. So it's actually quite remarkable, kind of the tools the clinic has gathered over time in the form of different volunteers. I mean, you just don't find things like this elsewhere. And it's kind of beautiful to see, because everybody works together, is in close contact with each other, is, even if they're not there, a phone call away in easy access. So patients, like the patient from today, who got Medicaid and was no longer going to be coming to Healing Bridge, you're right, Mike. They move on and they're just like, I don't want to. I'm not going to get this kind of care elsewhere, and that's just the reality, And it is sad, you have these excellent providers, and not to say other providers aren't excellent, but you have all these resources so readily available. So, but yeah, we see adults, and I'm a family practitioner, but we see adults for everything: physicals, acute visit, chronic care management, everything under the sun. So that's what's unique about us too, is the access to specialty care also.
Well, and I think the beauty of what it is that you're doing is you not only provide the medical service, but you're providing passion. You're not, you're doing this for all the right reasons. And that comes out when you're dealing with your patients, I'm sure.
Yeah.
Absolutely. Absolutely.
Now, are all Sydney, are all the clinicians, are they all volunteer or some paid staff? How does that work?
Majority are volunteer. There are, again, Mike, correct me if I'm wrong. There go ahead.
No, just one.
One staff. Sorry, yeah, one staff clinician, and everyone else is volunteer. So it's really also remarkable how many hours the volunteers are putting in. It truly is a passion. They'll go and work 60 hours, at their own practices, many of them 60, 70 hours, and then come and do an additional day at Healing Bridge. It's just, it's a beautiful thing.
Mike, how do you find the clinicians?
Yeah. If I'd like to build on what Sydney just said, and then I'll answer that question.
Sure.
Of those volunteers that come, two of the volunteers give up 2 billing days a month. They literally come during normal clinic hours when their office is open, and they're volunteering 2 Tuesdays a month and giving up paid patients to come and volunteer. So that even speaks to the heart of not just those two doctors. It's an internal medicine doctor and a podiatrist. So the one's bringing a specialty in podiatry in for all of our diabetes patients. But the fact that they're leaving their paid office to come to volunteer for us sends a lot for them and their hearts as well.
That's phenomenal. I mean, that's just incredible. Now, how are you finding them?
So when I started in 2018, we didn't have near this many doctors. We were struggling to grow the clinic because we couldn't find providers. So literally, I went old school, Steve, took a sales background. The best way to get a sale is to knock on doors, right? So I put together a little informational packet with a little introductory letter and a couple of pieces of literature. And I just started going to offices and dropping them off and introducing myself and putting a business card in there. If you have anybody that wants to volunteer, let us know. Then I realized that I'm not making much headway with the doctors. But if I went in and said, if you have a mid-level that you would like to see connected to your community, and that way I'm connected the mid-level to the name on the door, right? Then we started getting phone calls. We started getting calls about people. And, we don't want to say this out loud too many times, but we're blessed to the point now today where people are finding us. We're not really recruiting. The recruitment we're doing now is for those one-offs or two-offs specialty stuff that we need just a handful of times a year. And we don't really count those. Like our ENT doesn't come into the clinic. We don't really promote that we have ENT, but we kind of have a verbal agreement with the local ENT doc that says, yeah, you have somebody, call me. I'll see them, but we don't really promote that we offer those services.
Sure. Well, Cindy, tell us how you got involved with the clinic.
I'm originally from Tampa, Florida, And my husband and I made the decision we would move for his work to this area. And at that time, I was just like, I have got to do something. I had been looking at, volunteering, extra hours in the Tampa area in a, free clinic. And I was just, I was thinking about it, praying about it. And I was like, I just got online and I was like, free clinic, Peachtree City, Noonan area, and Healing Bridge was one of the top hits. And so I just went, I was like, let me just see. And I found the email online and I emailed, the clinic coordinator and I was like, hey, I'm moving to the area probably in the next, 6 months or so. I'm getting licensed in Georgia, getting my certifications and whatnot. Um, Additionally, to practice in Georgia, if you guys need help, I would love to meet or, something to that accord. And I got a response in like record time. I think it was like either the same day or the next morning. I was like, oh, it's amazing. So, and I think rather quickly, right, Mike, we set up a Zoom call and did like a Zoom interview. I think it was on my lunch break at my practice at the time. And we really hit it off. And then, so as soon as we got up here, I was like, get moved in the house. First things first, let's go check out Healing Bridge. And I just loved it, like immediately was in love with it.
That's awesome. Hey, how is the clinic funded, Mike? What's your funding recipe?
Yeah. So we're funded by the community, just the generosity of our community, whether it's individuals, churches, local businesses. We have a pretty aggressive grant writing program. So we do write a lot of grants, everything from local grants through like Rotary clubs, Kiwanis clubs, EMCs, Noonan Utilities, all the way up to larger grants. Earlier in the interview, you had said something about Georgia Baptist. When they sold that hospital, they started a healthcare foundation. So we get funding from the Georgia Baptist Healthcare Foundation. But we're constantly seeking grants. There's a lot of, I kind of dedicated a number of hours each week to do nothing but grant research. And of course, there's grant writing on top of that. And we do have a development director that she and I kind of co-lead the grants and share the grant writing between the two of us. And but I say it's like your freshman algebra. Like if you miss a day of submitting a grant, you're behind, right? So I mean, funding is every nonprofit you talk to, you ask them what's your greatest need. That we all say funding. So I try not to say that. I try to say relationships because if I can build the right relationship, this funding will follow the relationship. The key to me is meeting the right people and building those relationships, and the funding always follows through to that. But you also have to have a plan, Steve, to get the funding in here. So we also do fundraisers. We do a sporting clay shoot in February. We do a golf tournament in April. And then we do a fall fundraiser, September, October timeframe. We'll do something in the fall, some type of event. Not always a gala, but some type of fundraising event in the fall.
Yeah, I know you've had some golf outings and some skeet shooting, I think, those types of
Yeah.
things for
Yep.
fundraisers.
Yep.
Those generally work for you. Do you get a lot of participation?
We do. Of course, in this community, there's a golf tournament every day of the week. So,
That's the beauty of living in Peachtree City. When
it
you
is.
got 4 golf courses,
Exactly. Yeah, exactly. So, the golf tournament is what it is. Everybody has a golf tournament, so you're going to get kind of the same people every year in your tournament. But what's successful for us is that clay shoot because it brings in a total different group of people.
Right.
And surprisingly, a lot of medical professionals love to shoot clays. So it's bringing in more resources for us too in introducing our clinic to doctors and to offices that we otherwise may never meet. But they're willing to come out and spend a Saturday with us down a Big Red Oak shooting clays or shooting pheasants. And the next thing you know, they're signing up to be a volunteer or signing up to say, hey, we'd love to come to your fall gala or whatever. So yeah, it's been a great resource for us.
Mike, tell us about some of your sponsors that you have that work with the clinic. And I'll roll
Yeah.
through some of these as you tell us.
Yeah, we have great support from our community, Steve. City of Hope not only is an annual sponsor where they provide funding for events and things like that, but they also provide services for our patients. And so we have patients that are going down there for cancer screenings, and God forbid they find out they do have cancer, then treatment follows that. And City of Hope is just a huge supporter of our clinic, and our patients are so blessed to have that relationship with City of Hope.
And they're located in the Noonan area, right?
They're
Yeah.
City of Hope Atlanta, but they're in Noonan, yes.
Right. Okay.
QTS is the new data center being built there on 54. Got in with those people early on, and they've been great supporters. Steve Newton is a local attorney here in Peachtree City that loves what we do and is a big supporter of us. And of course, Piedmont Fayette is a supporter of us as well. Stride Anew, I mentioned our podiatrist earlier today in the interview. That's Stride Anew is her practice. So not only does she give multiple hours and days a week, but they also support us through events and funding. Resurgence Orthopedics, they send us doctors, and they also do orthopedic surgeries for us. So we have patients getting knee replacements and hip replacements and their shoulders fixed, and just amazing orthopedic surgery that comes through with the guys at Resurgence. So we're so happy and blessed to have them.
And the beauty of this, Mike, is I'm going to kind of go through these. It's titled Friends of the Healing Bridge Clinic. Look, and this is for the viewers, look at the community response that this clinic is getting. These are local industries, businesses, retail stores, nonprofits, a lot of great stuff going on through there. So this is what you can achieve if you put your back into it, go out and get these people and get your local businesses involved in this. And then we've got some of the nursing partners. You want to tell us about some of them?
I'm glad to. Local nursing schools send us students to get hours and experience. And what's not on there is we just added Georgia State Perimeter College to our. In fact, we had 3 of their students in today. And the nursing students and Sid can speak into this as well, but they just provide an amazing service to the clinic, and it's a symbiotic relationship. We provide a great service to those students too, to get the experience they get in what a community clinic might be. And I don't know if Sid wants to speak into the
Yeah,
students there or not, but
I was going to say, Sydney, tell us about your experience with the students.
Oh, I mean, I love students. I love to teach, but also, yeah, Mike was completely correct. It's definitely symbiotic, and they help us, we help them. I'm doing, pelvic exams and PICC line dressing changes, and having the extra hands is awesome, and we have the time to teach them. So it's nice to be able to sit down with a provider and have a provider go through, the healthcare aspect of the diagnosis and treatment and management also from a bedside standpoint too. So yeah, we learn from them, they learn from us, and having extra hands is just fabulous.
And these are all schools in close proximity to Peachtree City where your clinic is. So it's really been a blessing to have
yes,
these schools so close by. And it makes it very convenient for the nursing students, I'm sure. And
absolutely.
and then we've got some of these from the Georgia Charitable Care Network. I don't know what that is. What is that?
Oh, so that's a network that started 20 years ago. That free and charitable clinics can pay to be part of the network. But what that is it's a network where we get together twice a year in the spring and in the fall for our conference, and then an executive director retreat. And it's just an opportunity for us to hear from some of our state lawmakers at the conference, to hear about maybe new companies coming in with fundraising techniques, or maybe there's new medical technology that they're bringing to the free and charitable clinic world. But the beauty of that is the networking time where we build relationships and friendships with other executive directors and peers. So I'm now taking our clinic coordinator and our medical director to the spring conference, and they're talking to peers of theirs in other clinics. And it's so neat when our clinic coordinator runs into a situation she's never experienced before and not real sure what to do. She's got contacts in her phone, and she can start calling people and go, "Oh yeah, we had that happen." And, and it's just a great networking and a great kind of a growth, if you will, to help us. It's just a pool of people that are able to help us. And then the NAFC is that same version, but nationally.
Okay.
So there's about 110 108 clinics, I think, in the state of Georgia. Nationally, there's about 1,700 free and charitable clinics nationally. So that's just more on a national level.
So, if I lived in a community that didn't have such a clinic and I was thinking about starting one, I'd imagine those two organizations would be fairly good resources. Is that correct?
Yes, if you're in an area that doesn't have a clinic and you're thinking about starting it, the first call you need to make is to me, and I'll walk you through the steps, and then I'll connect you to the Georgia Charitable Care Network, because that's the first call you really need to make when you're establishing something, because they're going to walk you through how to set up a clinic. They're going to walk you through what you need, give you the resources that you need to do it.
Awesome. Tell us how you do the eligibility requirements for the patients. Do you have somebody that screens them, Mike? How does that work?
Yeah, so our free clinic is part of the Georgia Volunteer Healthcare Program, which is a division of the Department of Health. And they put on about a 35, 40-minute training for eligibility specialists. And then each clinic may have additional requirements beyond what the state requires. So for us, we require the state paperwork, and then we also require proof of income, proof of residency, and a photo ID. So we have these volunteers. We have a large pool of eligibility specialty now. We're blessed with that as well. Um, Again, 7 years ago, we had like 2 people that could do that. Now we literally have 3 and 4 people there a day doing it. So it's great. Um, but each year on July 1, we have to recertify everyone. That's a Healing Bridge policy, not a state policy. So that means that on or about July 1, you have to show a proof of income again. You have to show proof of residency, and you have to have a photo ID. And we just upload all that stuff into their EMR to make sure you're eligible. Then on your return visit, we're asked the question, has anything changed with your income? You still at this address? But they have to show that stuff the first visit after July 1.
Well, Cindy, tell us about some of your interaction with the patients and how your services have impacted their lives.
Ooh, where to begin? I think each visit, new patient visits, you want to, get to know them, give them the opportunity to speak and discuss about themselves, and then just building that rapport. And then from there on out, it's like, what are your needs and how can we meet them? So, traditionally you think of primary care. I'm just going to get my physical, get medications refilled, the preventive screening, colonoscopies, that kind of stuff. But really, Healing Bridges, we get to know you as a person, and we want to know you as a person. We want to, provide more than just, hey, all right, come in, get your scripts, you're good to go. That's not at all our mentality. This is not a fee for service. You get 10 minutes of our time, go home, and see you in another year. We really have the time to spend with patients and to get to know them. And it's a beautiful thing. But it's, yeah, everything from, chronic care, diabetes, high blood pressure, stroke history, heart failure. I had a new patient the other day that was there for chest pain, abdominal pain, low back pain, and like 3 other things. So it was just, let's get you taken care of. Let's address whatever we can today, and then we're going to bring you back quickly and address everything else. So it is nice to get to know them and have the rapport and the continuity like a traditional primary care provider does have.
And I would imagine you're seeing a lot of the people who would ordinarily get dropped in the cracks somewhere of society and and
Absolutely.
and would
Yeah.
not receive, let's just say, the quality and the quantity of care that they would probably require where they could be seen on an ongoing basis, which probably
Yes.
also helps the hospitals, because I imagine you're taking a lot of pressure off the emergency rooms at the
Yes.
hospital, because that's
Yes.
probably where they'd be going, right?
Yes. Yeah. I became a nurse practitioner because, I worked in hospitals as an RN, and I saw the need there even then. People going to the ER that shouldn't have been to the ER had they had access to a primary care clinician. And the jig stops with us, so to speak. If I can keep people out of the hospital or urgent cares, that is my number one, so I can take care. I do not want you to go to a hospital unless it's absolutely necessary, and people come in who have, not had treatment, who have, I mean, very serious conditions, heart failure, for instance, diabetes untreated, and haven't had medicines in, years. And they come back and they're like, what, they don't even know what they were taking, let alone, and so getting them back on track and having the means to do that. And you can see they're, pretty reticent when they first arrive. They don't know what to expect. They don't know if they're going to get, some, back alley, provider who doesn't know what they're doing. And then they quickly realize when they talk to us, they're like, oh my gosh, and then it becomes not that we do it for this, but they're so thankful and appreciative, when they leave. So I think, quickly getting them back on track and showing that, hey, we're doing this because, we enjoy it, and we enjoy, at least for me, the primary care aspect of things is just a delight, really.
How does the clinic handle medications? Do you distribute medications from the clinic, or do you send them off to the pharmacy? How does that work?
So we get donated medications from a couple of different places. So we do have some medications that we're able to give out. For the most part, we work with an organization called Good Pill, which is kind of a mail order pharmacy. So unless the patient just wants to pick them up at a local pharmacy, we script everything to Good Pill. They don't have everything, but they have well over 1,000 different drugs growing every day. And the beauty of Good Pill is a patient can get a 90-day supply for $6. So they're not free meds, but they're basically free meds.
Right. That's
Close to
about as good
free.
as it gets. That's about as good
Yeah.
as
Yeah.
it gets.
Yeah.
Well,
hmm
and how about these patients, Sydney, that require probably continued care, like the diabetes patients, or maybe people who are having the blood pressure issues and they can't control it? Are you getting them in on a regular basis? Are you seeing
Oh
more
yeah.
compliance with them?
Oh yeah. Oh yeah. Absolutely. I have, one gentleman, for instance, that travels about an hour. And if I'm like, hey, I want to see you back in a week because when I first meet your blood pressure is sky high, he is coming back. And and it's so there's, I can't speak for everyone, but I see, at least with my patients, I have some, we stress to them the seriousness of, hey, here's what's going to happen if you don't, take care of
Right.
business. But they're coming back in and we're getting things under control, diabetes, high blood pressure, you name it. I kind of have
Okay.
to, sometimes it is what it is. And, you have to be tough with people, while maintaining that rapport. And, if you don't do this now and get this under control and take this seriously, you're going to end up in you could take this one med, or you could end up hospitalized and be discharged on 4 new medicines, so you also have to look at get it under control now. And here's what happens if we don't. Here's the reality of not doing so. But
And
yeah, I have great compliance with patients.
And I know with some patients like this, where they're just doing everything they can to get by
Oh
financially.
yeah. Yeah,
And
yeah.
there's so much pressure on them, especially if they have a family involved, if there's children involved or whatever, and
Yeah.
they're
Oh, yeah.
trying to make it. Do you sometimes feel like, or do you, in fact, have to get involved more with the psychology of the patient as well, in terms of hearing what they're going through, trying to
Oh,
identify with that
absolutely.
patient?
Yeah, absolutely. I can't, you empathize wherever you can. But yeah, if someone is sitting there saying, I can't afford this, I mean, I'm believing them, some people are like, oh, you got to do it, no, I'm going into our drug room. I'm seeing what we have and we can hook them up with. You can't afford we have glucometers. We're going to get you glucometers. You don't have a blood pressure. I have blood pressure cuffs. You need a ride? We'll get you a ride. We'll get you from A to B, to get, we know how serious it is. And again, may have not walked their walk, but I can surely empathize with their situation. If they're honest with me, I'm going to be honest with them, and we're going to get them taken care of. So yeah, we see that all the time. We hear about all their family situations. And not to drag COVID into this, but you want to talk about the mental health aspect of things, the depression, anxiety, and a myriad of other psychiatric related issues that have only amplified since COVID. I think it's like was 1 in 5 anxiety disorder now. It's like we're looking maybe more 1 in 4, and we've seen it. So absolutely, the mental health toll, and then the interplay between that and the other health conditions. Oh yeah, I mean, so many people come to us with mental health conditions that require just as much, if not more, attention.
And that's so much better for the patient and the patient's family than going to the ER, because the ER
Oh
is going to treat you and get you out the door because they've got 20
yeah.
people behind you waiting to get in. So that personal touch is something that the clinic can provide that you're just not going to find in the large hospital setting.
Oh, absolutely. Yeah. And having worked in the ER, that's exactly right. And it's, people get out of the ER, they don't even know the discussions they had while they were there. I don't remember what they told me. I don't remember what medicine they put me on. I don't even know what the diagnosis was. You're stressed. I mean, you're sick, you're stressed, you're not absorbing any of that education in the ER. So that's again where we come in. Let me break it down for you. Let me, explain it in a way that's going to stick, and follow me along, or I'll follow you along to make sure it gets taken care of. So,
Well,
absolutely.
well, Mike, do you all refer out to any of the social services or anything? Do you have a relationship where if you see a problem that's not necessarily a clinic issue with a medical condition, that you can still refer them to somebody else? Do you can you keep those kind of relationships?
Yeah, we do. We work with other nonprofits that kind of provide the services that we don't. And because we serve multiple counties, some of the local people only serve Fayette or Coweta County. So we got to have those relationships, more than one of those relationships. Um, but we try to stick, we're trying to like Chick-fil-A, Steve. They sell chicken, right? And they're good at that. So, you know, we provide free health care for the circle that we serve, and we try to make sure that we stay within that. So we're empathetic with you that you don't have housing, but here's a list of people that provide housing, right? So we try not to get too far off of the path of who we are. But yet we have a resource book, and I'll just plug the nursing students again. We always have an SLP, the Senior Learning Project, for the last semester nursing students at West Georgia. And a couple of years ago, we gave them the project to create a resource book for Fayette and surrounding counties. So we have that not only in English, we had it translated to Spanish as well. So we have a county resource book that lists Fayette, Coweta, Meriwether, Spalding, surrounding counties, that has thrift stores and has food banks and has, all these different resources in them. So we're constantly giving that out. And one of the things that we've been blessed with, you asked earlier about how do we find providers. We literally had a psychiatrist reach out to us 3 or 4 months ago and want to volunteer. So now we're able to schedule some appointments that before we had a service. We partner with an organization called the Giving Health that is basically an extension of our services. So they do everything via telehealth, but they're available in our non-open hours. So a patient basically has 24/7 access to care with this relationship. We were primarily using them for counseling services, and we still do. But now that we have this in-house psychiatrist, that's only going to take the level of care that we provide up another level. It's going to open up more doors. It's going to open up more opportunity for our patients to get healthy, get their lives back, get back in the work environment. And we try to celebrate that. When we have a patient that gets a job and gets insurance and is no longer a patient, we celebrate the fact that they're no longer a patient. Like, we miss them, they miss us, but we celebrate that, because if we're doing what we're supposed to be doing, you're a patient of ours for a season, not for life, but for a season, right? So we want to equip you to get through that season you're in to move on to a better
Hmm. Hmm.
Well, what do you do? Is there, I know a lot of these folks. I read some of the patient testimonials on your website. You take some of these people that literally have very little hope. Their health is in poor, they're in poor health. Maybe their job situation is not good. Maybe their family situation is not good. And then you show a before and an after which they look like two completely different people after they've been seeing the clinic. And I was wondering, is there a spiritual dimension to what it is that you're doing at the clinic there that gives them some sort of hope or something to go on?
Yeah. I mean, we are a faith-based clinic, so everything we do involves our faith in Jesus Christ and his ultimate healing power over everything. So on Tuesdays and Wednesdays, we start each day out with a huddle, and we gather in our conference room and we kind of go through the daily schedule. And then we ask for prayer requests and we pray for certain, whatever anybody brings up, pray for the day. Our providers have full freedom to stop and pray with the patient while they're in the room. And many of them do. So we don't force that on anyone. We accept anyone of any religion from any background. But at the same time, if you are seeking that spiritual aspect, we will provide it to you and help you with that walk as well.
The clinic is going through a renovation expansion process, multi-stage, I believe. Tell us about that, and then tell us what somebody who's watching who may want to donate to the renovation project, how they can do that.
Sure. Well, thank you for that opportunity, Steve. As I said earlier, when we started, we were sharing a space in a building owned by First Baptist Church, shared it with their Hispanic ministry and other ministries of the church. And as we started growing and the need for additional days became a factor, we were limited to that because of the multiple use of the building, and the fact that we had to set up and tear down every time. So I hadn't really started looking for space in the community. I was looking for a building. Um, didn't really want to give up the free rent, but at the same time, we needed to do something in order to grow the clinic because the community need was there. We didn't question the need. It was a literally build it and they will come moment. Like we knew it was there. So as I'm looking for locations and looking for space, the senior pastor over at First Baptist reached out and we went to lunch one day, and he said we would love for the clinic to be the sole occupant of that building. And I said, well, we'd love that, nothing more than that. He goes, well, we'd have to charge you rent. I'm like, I got to pay rent when I move anyway, so like that's fine with me. I said, but two things: I need a long-term lease, and I need to be able to renovate the building because we can't use the footprint the way it is. And they were open to both of those. So we met with the local architect. I told him what the building, gave him a print of what the blueprint of the building was currently, and said, these are the needs that we have, make it work. And he did a fantastic job of designing the space. And I had mentioned Misha Construction earlier. We contracted them to do the remodel. We basically took the building down to the 4 exterior walls and rebuilt it, relocated bathrooms, re-ran plumbing lines, like re-ran water lines. Like we basically built it from the ground up, but inside those 4 walls. And so in order to do that, we had to launch our very first ever capital campaign. So in September of 23, we launched $1 million 36-month campaign to remodel, to furnish, and to expand the clinic. So we kind of did it in stages. So the first stage, of course, was to gather the funding to pay for the remodel, and then we needed to finish it with furnishing it and put something in all the rooms. And then now we're working on expanding the hours. With that becomes additional staff as well as volunteers. You can't do what you're doing with what you have. You got to have more people to do that. And that's the phase we're in now. So we're in our 22nd month of a 36-month campaign. We raised 92% of the $1 million, so we're a little over $900,000, and we'd love your support and the community support on that. So if you want to be part of that and helping us cross that finish line, you can literally go on our website at healingbridgeclinic.org and click on the building campaign, and make a donation that way. Or you can just call us and reach out if you want to send us a check or whatever. We can make those arrangements as well. But we're so close. We're confident we're going to cross that finish line long before the 36th month. But at the same time, we're kind of in that campaign fatigue stage, right? we've raised
Right.
$900,000, and that last 100,000 is harder to raise than the first
Mhm,
100 was.
mhm.
Yeah, it's
Yeah,
always that way, you know.
it
You
is.
you
Yeah,
can see the light at the end of the tunnel. You just can't get there. You know, it feels like it takes
exactly.
forever to get there.
Yeah,
Well, that's
yeah.
awesome though that you're that far ahead. That's truly a blessing. And I'm going to leave you with this. We'll do the last part of the interview here. One thing I would love from a viewer perspective, I would love both of you to give some advice to people in other communities who might entertain the idea of starting a clinic like yours. And, you know, Sydney, let's start with you. If you'll just do it from what you think the benefits are to doing something like this, the impact that it has on the community and on those patients' families. And then, Mike, when she's done, let's go to you about this is what I would do if I've got an idea, and this is where I would start, you know? So, Sydney, you want to kick it off?
Yeah, so as far as benefit, I think you kind of hit the nail on the head earlier when you just said, reaching those people that just are without, the people that fall between the cracks that, think I can't afford it, there's no hope. Um, there absolutely is. Me as simple as Googling free clinic in Georgia, and this is one of the first hits that came up at the time. It's just there is absolutely, there are resources out there. So community impact, we say reduction of hospitalization. We can go on about, the numbers and the financial benefit of that, but quite honestly, anyone we can reach, any one person can therefore go and impact others. If I have a positive experience with one patient, who's to say he or she won't leave the clinic and, spread the joy, spread the good word, the faith, there's always hope, there's always resources. If they bring in, if that one person brings in another patient, and we find a cancer or, prevent a stroke or, it's just little things that we might not see, past the bad in our day, but the good that comes from these little things we're doing throughout the day. um, so that's the individual and then thus community impact. I think that can come from that. And as nurse practitioners or providers in general, physicians, PAs, it doesn't matter. I mean, just do it. If you're thinking about getting involved, there's nothing bad that will come from it. It can only be positive. It's only been a positive, fun, loving experience for myself. And I'm very blessed to have found the clinic and had, Mike immediately reach back out, to this crazy lady from Florida, out of nowhere. But, it's just been such a positive experience for myself and those around me. And I tell everybody about it. I say, you need free care? Come on over. And they're like, I'm like, what's stopping you? Come on over at church, out in the community, random, like, again, this crazy lady, you need health care? Come on. It's just, and they think it's transactional. I'm like, just come on over. So, and it's worked for a few. So again, anyone we can impact is better than none.
So, Mike, I'm a person in the community. I've got an idea. I like what I've heard in this interview. I would love to try to entertain that idea and get started on something. What would I do?
Well, I would reach out. You need to reach out to a clinic in the area and just have a cup of coffee, and we'll talk through some of the uh, groundwork and some of the steps that you need to start. And then don't be afraid to ask questions. So if you reach out to me and say you wanted to start a clinic, the first thing I would do is kind of walk you through with the needs that you need to start with. And they're not what you might think they are. They're not as big as you think they are. You start small and work into it, right? But then I would also connect you with some people that can walk that walk with you, and be there for you. And the one thing that nonprofits get started every day, and depending on the nonprofit and depending on the people driving and the visionary behind it, sometimes they are they blossom very quickly, and other times they just dilute the area. And what I mean by that is there's only so many people in this community that's going to donate. And the more options you give them, the less that somebody's going to get, right? So, but if you work with people, you can work things out. So collaboration is huge. um, Collaborate with people, ask questions, be there. But as Sydney said, don't just sit on it and think about it. If you feel like you want to do it, do it. have those conversations, and don't be afraid to take a step out in faith, because if you're doing it for the right reasons, it's going to come together. You're going to find the supporters, you're going to find the volunteers, and you're going to find the success that you feel like you can make if you're doing it the right way for the right reasons.
Well, Mike and Sydney, you're doing a noble thing. You're doing God's work. And I hope this has inspired somebody in our greater Georgia community to go out and try to see if they can do this in their community if they don't have a clinic like this. Thank you guys so much. It was very informative. We really appreciate all your good work.
Thank you,
Thank you
Steve.
for having
Appreciate
us.
you.
Thank you so much for staying with us on this interview. I really enjoyed doing this. I love projects where people come together, build a sense of community, help other people in the community who need it the most, make things happen. It's a source of pride for every community in Georgia. So if you would like, share, subscribe, pass this on to some communities where you think they could use this help, where the hospitals aren't necessarily readily available, where the emergency rooms aren't always open. You can make a difference in your community. And we hope that this interview with editorialinterchange.net has helped you. And if there's somebody you think we should interview, or if there's a project of interest that you think we should talk about, hop onto our website, let us know. It's editorialinterchange.net.